Hello everyone, this is Dr. Humanist again. Let us now discuss about the ECMO, that is extracorporeal membrane oxygenation. Okay, what is it? It's a life support technique which provides cardiac as well as respiratory support by oxygenating the blood outside the body. There are mainly two types, veno-venous and veno-arterial ECMO. Right, veno-venous, it is used for primarily respiratory support. The blood is taken from the vein, oxygenated and then given back to the vein itself. Okay, mainly when we have to oxygenate the blood, we use veno-venous, that is respiratory support. Veno-arterial, on the other hand, we are using it for cardiac mainly and respiratory support both, right? So respiratory oxygenation will happen, but when you're taking the blood from the vein and then delivering the oxygenated blood into the arteries, we are skipping the work of the heart, right? Directly we are delivering into the arteries, and from the arteries it will go to the tissues, right? What are the indications? Respiratory indications like severe ERDS, pneumonia, pulmonary embolism, COVID-19 respiratory failure. Cardiac indications: cardiogenic shock, post-cardiac surgery, and myocardial infarction. Okay, even the patients who are posted for the transplantation, those who are in the transit, we can use ECMO, like in a lung transplant or heart transplant cases. What are the contraindications? Absolute contraindications being terminally ill patients with poor prognosis, when you cannot avoid the death. As I said, it's just a life support, it's not treatment, right? Severe coagulopathy, major irreversible organ failure, that is the poor prognosis. So these are the absolute contraindication. Related contraindications being advanced age with any comorbidities, severe vascular disease, and neurological conditions like persistent vegetative state. Okay, so now coming to the what are the components of the machine. First one is blood pump, which circulates the blood through the circuit, right? The blood which is received from the vein has to be circulated in the circuit, right? So for that, blood pumps. Next is oxygenator, which removes the carbon dioxide and adds the oxygen to the blood. Heat exchanger is also necessary, which maintains the blood temperature. Next is cannulae, like large bore cannulas will be there, venous or arterial cannulas. Monitoring devices, right, for the vital signs and the circuit functions monitoring. Other than that, heparin is used, right? Procedure: first is cannulation, inserting the cannula with the blood vessels into the blood vessels, like femoral vein and femoral artery is commonly used. Circuit connection, okay, then initiation, that is activating the pump and ensuring the proper blood flow through the machine, and monitoring. Continuous assessment and anticoagulation management has to be done, okay, because there can be clot, there can be mechanical failure because of that. So continuous monitoring, we have to see the pressure differences, right, to see if there is a clot inside the machine, right? Monitoring necessary. What are the risk and complications? So complications like bleeding, because we are using anticoagulant, that is heparin here. Infections, okay, right from the central line, and pneumonias or sepsis. Thrombosis, organ dysfunction, right, and mechanical failure, that is issues with circuit or equipment. So duration typically used for days or weeks, but depending on the patient's condition and the recovery. Okay, so weaning we can do once the patient's hemodynamically stable and he is maintaining the oxygenation by itself. Then we can gradually decrease the pressure of the blood going to the circuit and then wean off. Thank you.